Jose Mundo came to Guam Regional Medical City after suffering his third heart attack.
I had like 3 heart attacks. So the first one was about like 2 years ago, which I didn't pay much attention of it because I thought it was just a minor chest pain. Till it hit me on October 31st is when it got more serious.
According to Dr. Joseph Wiederman, the interventional cardiologist at GRMC, poor eating habits, smoking, and other causes can escalate the situation, leading to a complete blockage and then heart attack.
What happens is that over the course of years, usually due to risk factors such as hypertension or diabetes or smoking or high cholesterol or a combination of them all, cholesterol begins to build up in the artery. When that cholesterol builds up so that it obstructs flow to 80 or 90%, then the blood flow in the artery itself begins to become sluggish, like it would in a pipe in your basement. When that happens, a tiny blood clot will begin to form over that 90% blockage and take it very quickly from 90% to 100%. That 100% blockage, that's what the heart attack is. And the sooner we can open that artery, the less damage is done.
The ideal treatment for a heart attack is a procedure called a coronary angioplasty. A small tube is inserted into the leg to access the circulation system. Next, using X-ray guidance, small catheters are inserted into the heart so a dye can be injected into the arteries and followed on screen to see where the blood flow stops. Once the blockage is identified, a small wire is passed through it to deliver a balloon which reopens the artery, restoring the flow of blood. The next step is to implant a piece of metal tubing with a drug coating called a stent to permanently hold the artery open.
So the recommendation is that if you are given a drug for thrombolysis, which is what this is called, to open the artery, then you have catheterization within the next 24 hours to definitively fix the blockage, because without that, you still have a 90% blockage, you can have another heart attack the next week.
Unfortunately, in Jose Mundo's case, this is exactly what happened. After his first 2 heart attacks, he received the medication to dissolve the blood clot, but not the primary stenting. And all too soon, Jose began to experience a familiar feeling.
It's a heart attack, my third. So they were telling me it's a miracle that I survived. They said, a lot of them said that I wasn't supposed to make it.
Mr. Mundo had the advantage, which is not always the case, of having only one area of blockage. So he had a very severe 90% blockage in the mid portion of his LAD, which is the artery that supplies the front wall of the heart. But fortunately, it was only one blockage. So from a technical perspective, with God's help, it was not a particularly difficult blockage to fix. It was just a very dangerous one for him.
Mr. Mundo's surgery went smoothly, and his recovery was very quick.
After I got out of the house, after that next day, he told me to give it about 3 to 4 days. Then you can get back on your feet and head back to work.
Generally, people can go back to normal activities in a couple of days. The puncture site in the groin requires a little bit of caution for about 48 hours, but that really means nothing more than avoiding heavy lifting and not starting to exercise for a few days. In general, the recovery is very quick.
Mr. Mundo has made some changes to his lifestyle, cutting back on certain foods and giving up cigarettes.
He told me about 1 year I should be fully recovered. But that doesn't mean that I'm going to go back to my old habits. Having this third heart attack, of course, you're going to have to take your thing pretty in perspective. Yeah.
Cardiac disease requires lifetime care, and he will see Mr. Mundo at least twice a year to monitor his heart, blood pressure, and overall well-being.
Doctors like cardiologists like Dr. Wiederman is very hard to find nowadays. This is a very good hospital, and I recommend to come over here.
For more information, please call 645-5500 and ask for cardiology.